हाथ उचल. उजवा. पाय हॅलो. हां उजवा. Very good, very good. Hello, this is Dr. Vaibhav Chavan. Today I am going to present a case of the post-traumatic quadriplegia paralysis due to the cervical canal stenosis as well as post-traumatic thoracic vertebral compression fracture. This is a pre-operative MRI. We are going to discuss a radiology. Here on the cervical level, you can see this is whitish signal at the cervical cord. This is because of the post-traumatic cervical cord compression. You can see there is a cervical canal stenosis component up also. Because of this, he has a upper limb, bilateral upper limb weakness, more prominent on the right side. Lower down on the thoracic vertebra, you can see this is a D4 vertebra. It's compressed. His height is almost 50% reduced, and superior part of the D3 vertebra is also fractured. You can see the cord is bent like this. So there is a compressive element. We need to stabilize it. Posteriorly, you can see D1 and D2 spinous processes are fractured, and D3 spinous process is fractured at the base. So my initial plan for this patient is to do a cervical laminectomy as well as do a thoracic spine fixation in the same sitting. It's going to be a long surgery. So my plan is to put a screws in the D5, if possible in the D4 single screw in the fracture fragment, and on the D3 or D2 vertebra. So we have done a pre-op CT scan of this patient also. You can see there is a compression of the compression fraction of the D4, superior border of the D3 is fractured, D1 and D2 posterior spinous processes are fractured, and D3 spinous process is fractured at the base. These are the axial images. On the axial images, you can see the fracture fragment. So we have operated this patient, and as I previously said, this is the post-operative CT scan. We have done a 3D reconstruction of the post-operative CT scan. You can see I had put a screw on the bilaterally in the D5, unilaterally on the right side on the D4, and on D3 I couldn't put a screw because their spinous process was fractured at the base. So on the D2 vertebra I had put bilateral screws. This is 3D reconstruction. This is 3D reconstruction AP view. This is 3D reconstruction AP view. Now this is again sagittal image of the post-operative scan. You can see this is D2 screw, this is D4 screw, this is D5 screw. Let's have an axial view one by one. So start from the lower D5. You can see the D5 right side screw. This is a 3.5 mm, 35 mm screw which is going through the pedicle into the vertebral body. This left side screw is also going through the pedicle into the vertebral. This screw placement is good. It's not touching the neural element also, as well as it's not going too forward. So this is a D4 right sided screw. You can see it's going through the pedicle into the vertebral fractured fragment D4 screw. And this is a D2 axial image. You can see D2 right side screw is going through the pedicle into the vertebral body. On the left side, it's going through the pedicle but slightly off. It's going. It was not going through the vertebral body. So I had reinserted the screw and again put into the pedicle. So it has a good mechanical strength now. Thank you very much.